I chose to go because it made me confident to give birth. Like I could walk into the delivery room and know that I could do this.
The advantage of the centering model is you are with the same group for 10 visits throughout your pregnancy. You have the same provider, the same co-facilitators, and when you are seeing the same individuals, that trust level is increased.
The fact that they cared and were there and knew me by my first name, that was really a big deal.
If you do not know your patients, they're not going to feel comfortable with you. We want them to feel comfortable. We have to have a mutual trust for our patients to get the best quality patient care.
I got to meet other women who were doing the same thing that I was doing, and we could share our experience together, and that's what made it special to me.
Patients also learn from one another. They grow from one another. They have the expertise from their personal experiences that they can share.
We got to meet each other after our birth and have a reunion and meet each other's babies. We get to remember that experience, so that would be the most valuable thing about the centering program.
My friend Chin, she asked me that I want to come to this meeting with her, and this is my freshman year, so I was like, why not? And I came to the meeting and I never stopped coming.
I really believed in the message of Teen Advisory Council encouraging students to take control of their health, so I wanted to get other students involved in that too.
We do preventative care. We also do their routine physicals, their vaccines, mental health services. We sign kids up for insurance if they're uninsured. We even help them manage their asthma and diabetes.
Look at it as a private doctor's office on school property. So we provide comprehensive health services to kids while they're in school.
The clinic is really just down the hall from the rest of our classes. So if we're not feeling well, we can go straight here and then we can make it back to our other classes and we don't have to miss out on homework and get stressed.
It gives the students a real sense of responsibility because you do all this stuff on your own. You usually go to the doctor's office with your parents, but here it's all on you. I think that's really important because they're about to embark on adulthood very soon, and so if they can learn how to be healthcare consumers now, it'll be much easier once they go into the real world, if you will, and be a healthcare consumer. They also have a social worker, so you can come in here and talk to her. She really helps a lot of kids through things when they need someone to talk to.
When kids relate to a trusting adult, it makes a positive impact in their lives.
They not only encourage you, but they support you, and that can really help change the student's mindset. If you're healthy, you'll obviously do better.
We know that we improve illnesses such as management of diabetes, obesity, asthma. About 3 or 4 years ago, the statistics of bullying for one of our schools was very high, and that was reduced by 33%.
A lot of people don't believe that the students at Arthur Hill could do something like this, so I think this is really good.
When I used to go to other doctors, the wait times were horrible. Walked in, I felt horrible. Nobody talked to you. When I came here to Great Lakes Health Centers, that first day set the tone for everything else that turned out good for me here. It started with my back, and then I developed diabetes, high blood pressure. I didn't have the income to choose whatever doctor I wanted to.
He just had a lot of different conditions. Everything was kind of uncontrolled. His pain wasn't being controlled. Diabetes wasn't being controlled. And he just gave me the impression that he was really, really frustrated.
I almost came to tears of the overwhelming fact when they told me I had diabetes. But the medical assistant sat down with me until I felt better about it. She made me feel like, okay, it's gonna be okay.
We do tend to really get involved in our patients' lives. They kind of think of us as friends. So you really get this big picture of not just as a patient, but as a person, what's going on in their lives. And as a care management nurse, that's an important piece for us.
I got my dietitian, I got my doctor, I got my pain doctor. It just feels like an overall group effort to make me feel better.
He would do everything we asked him to do, even though sometimes we had those setbacks. And over time, we just kind of knocked one off after another and got him back to a point where now he's saying he's walking 3 miles where he was barely walking into the clinic before.
Another thing was I had severe depression in the beginning, and now my depression is all but gone. I'm happy about life again. When I first came here, I was in a dark area to the point where I didn't care. Great Lakes Health Center has helped me become a happy person again.
I think there's a perception in the community that we only serve the poor or those who are disenfranchised or underserved, but these services are for anyone in the community, whether they have private or public insurance or have no insurance.
We treat all our patients the same, no matter color, race, income status, and we provide the highest quality patient care.
I'm 45 years old. My body when I started here was 65 years old. Now I feel like I'm starting the path, thanks to Great Lakes Health Center, to get back to what my real age is. And I have no one else to thank but the Great Lakes Health Center for help getting me to where I am today, which is in a good place.